Hello and welcome. I'm Dr. Andrew Peterson, board certified periodontist practicing in Arcadia, California. Are you in need of a dental implant and wondering what does that process look like from start to finish? Well, what I've done for you today is I've created a short tutorial video about what the implant planning process is like at Arcadia Perio. So join me for the next 5 or 10 minutes and I will show you how I plan implants with the most up-to-date technology here at Arcadia Perio. So let's dive in. So when it comes to implant planning, I need to be able to see all the vital structures. I need to be able to see anatomical landmarks. So what does that include and where do we start? Well, it starts with a three-dimensional radiograph. So I can see vital structures. I can see those anatomical structures. The next thing that we do is we're going to take a scan, a digital impression of your teeth. These two pieces of data are critical for any implant planning, and you will see why here shortly. So, this is the data viewing software. What this data allows me to do is it allows me to blend or merge those two file types you just saw. I'm able to overlay the three-dimensional image with the three-dimensional scan. Here I'm able to see the soft tissue, the gum and bone, the teeth, the virtual teeth overlaid on top of the radiographic 3D imaging. From here, I'm able to start planning that implant process. So I want to walk you along in terms of how quick and how predictable implant placement can be when using the software. So what I'm going to do is I'm going to show you a video. This is how I plan every implant at the office chairside with you as the patient. I will take the three-dimensional image and I will take the intraoral scan and I will work up the plan with you chairside. So you'll get to see in real time with this technology how quickly we can move through the implant planning process. So sit back, relax, and let's watch this 5-minute video with my voiceover to explain the implant planning process. So the first thing that we have done is we have taken the intraoral scan. The next thing that I'm able to do with my viewing software is I'm able to digitally extract teeth or I'm able to plan teeth that are previously extracted. What the software is doing here right now is it is auto numbering the teeth. The computer already knows which teeth are missing. It's pretty incredible to see where the technology has come in such a short time. Now, with the use of AI-driven technologies built into DTX Studio, do you see here? The crown is already designed. So it's really important to know the end before we even begin. And that's what this digital crown and digital design does. You can see here, I am viewing this tooth in all different dimensions. I am moving the tooth left to right, top to bottom. I'm rotating that tooth around. I'm trying to make it match the teeth nearby or match the tooth on the opposite side. But the planning software normally does a very good job of planning that crown for us. Once I'm done editing the position, now I'm looking at the tooth again, just in a few different views. And now what I'm going to do is I'm going to take the digital plan with that digital designed tooth. And what I'm going to do is I'm going to merge these two files together. You can see here the software is thinking on its own and it's going to blend these two file types seamlessly within mere seconds. It's planned. That those files are overlaid. So now I'm seeing the soft tissue, I'm seeing the gum and bone, I'm seeing that proposed tooth form over the missing tooth to see how much bone you have, to see do I need to do any extra bone grafting when we place the implant, or is it a relatively straightforward implant? So now we've overlaid or we've merged the two data sets for you. So we're 2 minutes into this planning process. Now watch how simple the implant planning is. Look at that. 2 clicks. 2 clicks of the mouse, and I have a proposed implant already in place. Obviously, I need to move it around from left to right, top to bottom. I need to angle it. I need to choose the appropriate size implant for the space, right? Implants generally come in different sizes. For all intensive purposes, small, medium, and large size implants in terms of the diameter. And the lengths can vary greatly from 7 millimeters to 18 millimeters in length. But you can see here, you can see I'm choosing the implant that's appropriate for the size space. So now I'm looking at that implant in different views and the proposed implant. So you can see here, now I'm taking away data. I am removing the three-dimensional image. I'm removing the lower teeth. And now I'm merely focusing in on that tooth that's missing on the upper right. I want that implant to come directly out of the center of that tooth. You can see with this proposed plan, it is perfect. It is seamless. Now I'm doing some fine tuning. We want to keep that implant away from adjacent teeth, right? It needs to be a certain space. So you can see here, even in my planning software, that yellow outline around the proposed implant or that proposed screw is already my safety zone. The software already knows how far it needs to be away. So once we know what we're going to do in terms of the implant size and location, now I'm going to design a surgical guide to make the implant surgery take less than 5 minutes. And once you're numb, we're able to start moving very quickly. So there's different ways that I can make these guides, is really what I'm kind of trying to show in this figure right here. But essentially what I'm able to do is I'm able to choose the type of guide that I want, and I'm able to 3D print this guide in Office. The total printing time is approximately 20 to 30 minutes to print the guide in Office. What does that mean for you as the patient? We can design the guide today and do the surgery tomorrow. There's no waiting time to get this back from the lab. If you're in a hurry and you want to get this procedure done, I can make it happen. I can make it happen with this technology. It is wonderful to be able to be fully equipped and fully digital at Arcadia Perio. So not able are we able to 3D print guides to make our implants safe, predictable, and much more quickly than in the past. Furthermore, I'm also able to 3D print temporary crowns. So no more going around with that missing tooth for 4 to 5 months while the implant heals. As long as the implant goes in and it's nice and stable, I am able to insert a 3D printed temporary crown. I've been working with a lot of my referrals. They almost think that that 3D printed temporary is the final crown. I've actually gotten calls from my referrals that ask me why I did the final crown. And I said, whoa, whoa, whoa. This is only temporary. And my referrals and my referral network love the technology. We love how it's serving our patients better. So I hope you've learned a little bit about what the implant planning process looks like here at Arcadia Perio. So if you're in need of an implant, give the office a call, 626-447-0945, and I will be here to serve you. Thank you so much for joining in on today's presentation, and have a wonderful day.